Question 1. In what stage of the client-trainer relationship are health history and lifestyle questionnaires administered? A. Rapport stage. B. Investigation stage. C. Planning stage. D. Action stage.
Question 1 answer, B. Investigation stage.
Question 2. Dan is a new client whom you are meeting with for the first time today. He will most likely be evaluating you as a trainer through both your verbal and non-verbal communication. What stage of the client-trainer relationship are you in with Dan? A. Planning stage. B. Action stage. C. Rapport stage. D. Investigation stage.
Question 2 answer, C. Rapport stage.
Question 3. Kristen is in for her second session and you are conducting fitness assessments. While you are checking her body fat percentage, you ask her about types of exercise she prefers to do. What stage of the client-trainer relationship are you in with Kristen? A. Rapport stage. B. Planning stage. C. Investigation stage. D. Action stage.
Question 3 answer, C. Investigation stage.
Question 4. Your client tells you that he understands that his family has a history of heart disease and that being overweight can increase his risk for such conditions. He is still wary of beginning any kind of exercise program and says that he has never had any weight loss success in the past. According to the theoretical model of behavioral change, what stage of change is your client in? A. Contemplation. B. Preparation. C. Pre-contemplation. D. Action.
Question 4 answer, C. Pre-contemplation.
Question 5. In which stage of the theoretical model of behavior change is a client ready to adopt and live a healthy lifestyle? A. Contemplation. B. Preparation. C. Pre-contemplation. D. Action.
Question 5 answer, B. Preparation.
Question 6. According to the ACE integrated fitness training model, what step in the training process best follows the testing of resting measures, such as heart rate and blood pressure? A. Core function. B. Balance. C. Static posture. D. Health-related assessments.
Question 6 answer, C. Static posture.
Question 7. Which of the following is typically considered by clients to be the most important factor in creating a positive first impression? A. A trainer who is in good shape. B. A trainer who communicates well. C. A trainer who offers to listen to his or her home life problems. D. A trainer who has good posture and appears sure of themselves.
Question 7 answer, B. A trainer who communicates well.
Question 8. What is an example of nonverbal communication? A. Tone of voice. B. Facial expression. C. Body language. D. All of the above. E. Both B and C only.
Question 8 answer, D. All of the above.
Question 9. Saying things like, I understand, 125 feels like your ideal weight, is an example of which positive listening skill? A. Encouraging. B. Planning. C. Questioning. D. Paraphrasing.
Question 9 answer, D. Paraphrasing.
Question 10. Which of the following is an example of a good open-ended question? A. Do you feel that you are ready to begin a fitness program? B. Do you have any questions about personal training? C. Are there any exercises that you dislike? D. What made you decide to pursue personal training?
Question 10 answer, D. What made you decide to pursue personal training?
Question 11. You have been working with Judy for 1 month now. Her initial goals were to gain strength in her lower body, and you have been working on body weight squats and lunges. She can perform 3 sets of 15 squats without a struggle. What is the best course of action to continue to increase her lower body strength significantly? A. Continue with the program as it is. B. Add resistance to her squats and lunges. C. Increase the number of squats to 20 repetitions per set. D. Discontinue the squats and lunges until she finds them difficult again.
Question 11 answer, B. Add resistance to her squats and lunges.
Question 12. What is an example of the tell, show, do technique used in the early stages of training? A. Telling your client to show you how to correctly perform an exercise. B. Showing your client proper form of every exercise and allowing them to try it on their own later. C. Explaining the proper way to perform an exercise, showing your client, and then allowing them to try the exercise. D. Watching the client perform the exercise and giving feedback about the proper form.
Question 12 answer, C. Explaining the proper way to perform an exercise, showing your client, and then allowing them to try the exercise.
Question 13. Beth is a 28-year-old woman who is looking to improve her overall fitness. How long should she rest for in between sets on a leg press exercise? A. Less than 30 seconds. B. 30-90 seconds. C. 2-5 minutes. D. 30-60 seconds.
Question 13 answer, B. 30-90 seconds.
Question 14. Bob is a 30-year-old man looking to increase muscular endurance for distance running. How long should he rest in between sets on the leg extension machine? A. Less than 30 seconds. B. 30-90 seconds. C. 2-5 minutes. D. 30-60 seconds.
Question 14 answer, A. Less than 30 seconds.
Question 15. Andrew is a 35-year-old man who is looking to increase strength in his upper body. How long should he rest in between sets of a bench press exercise? A. Less than 30 seconds. B. 30-90 seconds. C. 2-5 minutes. D. 30-60 seconds.
Question 15 answer, C. 2-5 minutes.
Question 16. When training a client to activate their core for the purpose of gaining proximal stability, what exercise modality should come first in the progression? A. A sequence of movements in alternating planes with contralateral limbs raised off the floor. B. Sagittal plane shoulder movements with one arm raised off the floor. C. Frontal plane hip movements with one knee raised off the floor. D. Transverse plane hip movements with one knee raised off the floor.
Question 16 answer, B. Sagittal plane shoulder movements with one arm raised off the floor.
Question 17. James has been training for and competing in triathlons for 5 years. He wants to increase running speed and cycling power. How many times should you suggest he train per week? A. 2-3. B. 3-4. C. 4-6. D. 4-7.
Question 17 answer, D. 4-7.
Question 18. Bill is training at 80 to 90% of his 1 repetition maximum on leg press. How long should he typically wait before training his legs again? A. 24 hours. B. 36 hours. C. 48 hours. D. 72 hours.
Question 18 answer, D. 72 hours.
Question 19. Which of the following is within the ACE personal trainer's scope of practice? A. Advising a client on which types of supplements to take. B. Giving relationship advice to a client. C. Assisting a client in setting realistic fitness goals. D. Gently massaging a client's sore muscle.
Question 19. Answer C. Assisting a client in setting realistic fitness goals.
Question 20. Which of the following is appropriate according to the ACE personal trainer's scope of practice? A. Diagnosing a client's ankle injury. B. Massaging a client's shoulder. C. Teaching a client self-myofascial releasing techniques. D. Setting up a calorie-restricted diet plan for a client.
Question 20. Answer C. Teaching a client self-myofascial releasing techniques.
Question 21. An ACE-certified personal trainer must complete how many continuing education hours in what period of time to keep their certification active? A. 10 hours in 1 year. B. 20 hours in 2 years. C. 20 hours in 1 year. D. 10 hours in 2 years.
Question 21. Answer B. 20 hours in 2 years.
Question 22. Which of the following is not a symptom of inflammation at a joint? A. Pain. B. Warmth. C. Increased range of motion. D. Loss of function.
Question 22. Answer C. Increased range of motion.
Question 23. Which of the following is an absolute contraindication to stretching? A. Presence of osteoporosis. B. Joint swelling. C. Prolonged immobilization of muscles. D. A healing fracture site.
Question 23. Answer D. A healing fracture site.
Question 24. Which of the following is a form that notifies the client of the risk associated with exercise? A. Physical Activity Readiness Questionnaire, PARQ. B. Health History Questionnaire. C. Informed Consent Form. D. Liability Waiver.
Question 24. Answer C. Informed consent form.